My name's Nick Holland and I'm the CEO of the EJ Whitten Foundation. The foundation goes back 23 years and it really starts in the wake of the death of Ted Whitten Sr., Mr Football as he was known, not only throughout Victoria but throughout Australia. He unfortunately died too early from prostate cancer, and he was one of the first Australian men to be an advocate for men's health and really try and get men to be aware of taking charge of their own health, because unfortunately he left it too late to go and get a simple check. Shortly after that, Ted Whitten Jr. with the Footscray Football Club, as it was, set up the foundation, and the idea was to really raise awareness in the Melbourne, Victorian and Australian community and get it out there that men needed to talk more about their health because they had been sort of fairly stoic in the past. If anything would go wrong, they'd be reluctant to see a doctor. And so Ted Whitten Sr. got it out there through his death, unfortunately, and Ted Whitten Jr.'s continued on the legacy for 23 years.
My name is Nathan Lawrenchuk. I'm the director of the EJ Whitten Prostate Cancer Research Centre at the Epworth Hospital. Prostate cancer remains the leading cause of death in men still today, despite the inroads we've made into it as a disease. One of the quirks of prostate cancer is that most men who get diagnosed actually have no symptoms at all. Effectively, most men are diagnosed because they go along to have a blood test called a PSA, or a prostate-specific antigen test. That may or may not be accompanied by a rectal exam. In fact, it's not compulsory anymore. So men need not be afraid of that. The current guidelines allow for just the blood test. When that test is done, it's usually repeated, and if it's elevated, and we also combine other factors, do they have a family history, and so on and so forth, we may then have men proceed to having a biopsy done. So the vast majority of men will have no symptoms. The classic symptoms that men associate with their prostate, for example, you're at the urinal, you've got difficulty passing urine, 3 or 4 men come in beside you by the time you pass the water, really having to strain and push to get the urine out. They're almost never related to prostate cancer. That will be benign disease of the prostate, very easily treated with tablets or a simple surgery. The prostate's an interesting organ. You know, men often don't understand exactly where it is or what it does. Its primary function is to make the majority of the seminal fluid. You've got your bladder, and your prostate sits immediately below that, and then the tube that you pass urine through goes right through the middle of it. So it's just sitting there under the bladder. If we imagine that to be a mandarin or an orange, and in fact the prostate is about the size of a mandarin, although it can grow to the size of an orange or even a grapefruit with age. If you think about the mandarin, then the mandarin has an outer layer, or the skin, and the inside, or the pith. So prostate cancer tends to affect the outer skin. And that's why a digital rectal exam will often feel a nodule or a cancer. And that's why it really has no impact on the passing of water, which is right in the middle of the mandarin. However, benign disease of the prostate occurs in the pith in the middle, and that tends to push on that channel and cause the symptoms that men know so well. So that's why we talk about prostate cancer being the silent killer in a way, because it can grow quite big from the outer side of the mandarin before it even hits the middle, and it could spread without symptoms, and that's why the blood test is so important. For any individual male in Victoria, there's a 1 in 6 chance of developing prostate cancer. If you have a first-degree relative, i.e. a father or a brother with prostate cancer, then your risk actually doubles. If you have 2 first-degree relatives with the disease, then in fact your risk quadruples. So a lot of men ask me, how do I reduce my risk of getting prostate cancer? You can't change your family history, of course, but what can you do individually for yourself? There are a couple of key elements that have come out over the years. So one of them is exercise. So maintaining a healthy weight will reduce your risk of a lot of disease, be it cancer or non-cancer, but particularly for prostate cancer. Number 2, maintaining a healthy diet. And what do we mean by that? Well, what's good for the heart is good for the prostate. And many men will have heard of the Mediterranean diet. That consists of having more fresh fruit and vegetables, a little less red meat and protein overall, and not too much in terms of carbohydrate. That's the classic Mediterranean diet, and that's been shown to help reduce the risk of prostate cancer. And another thing which has come to light in recent years is actually the more sexual activity you have, that lowers your risk of prostate cancers. The last thing would be to not smoke and to have alcohol in moderation. And indeed, red wine has been shown to be a little bit protective in moderate amounts. So there are things men can do, And I think, it's up to each man to take control of their own situation. In time, with research and effort, we have improved prostate cancer in a lot of men to make it turn into a chronic disease rather than a death sentence. And so, a lot of men need to understand that you can live for a long time even if you have prostate cancer that's spread outside the prostate. I think it's a real shame that a lot of men think that prostate cancer treatment will result in them having erectile dysfunction or becoming impotent, or that they will have problems with their continence, or that they will have other issues related to their bowel and so on, and that their life will be terrible, and therefore why would I bother getting tested if the impacts of the testing lead to a very poor outcome? And in fact, what I can honestly tell you is that the vast majority of men who have prostate cancer we watch. We don't even do these radical treatments. But if you do need surgery or radiation, we have the state-of-the-art equipment, and the improvements in outcomes are magnificent. Prostate cancer accounts for about 18,000 cases a year across Australia, and almost up to 5,000 cases are diagnosed every year in Victoria. At the Epworth group, we deal with about 50% of the cases of prostate cancer. So you can imagine that on that scale, that is a huge number of patients we have to care for. We have the capabilities to bring together clinicians and researchers in the one place. And our idea is to really achieve better outcomes for patients overall. To do that, we have research into targeting the genetics of prostate cancer, offering optimal treatments, be it through robotics and other technology platforms, and finally having the best systemic treatments to improve longevity of life. So that's what we aim to do here, is to bring it all together in one place with the best people available.
It was a natural relationship that the EJ Whitten Foundation would partner with the Epworth Hospital. We build the awareness, we build the education, and they're the ones that do the research and treatment into it. So it's been a great relationship and a long-standing relationship. With 2018, we've seen the development of the EJ Whitten Foundation Prostate Cancer Research Centre, and that's a $1 million commitment from EJ Whitten Foundation and a similar $1 million commitment from Epworth Hospital to build the research and treatment into prostate cancer. And the aim is to get research to transgress into treatment as soon as possible, and hopefully it sees better treatment for men, longer lives for men, and healthier lives for men. The EJ Whitten Foundation's community message is it's time to test, and that means that for your prostate health, if you've got a family history, you need to book in to see your doctor every year to get a PSA test. Even if you don't have a family history of prostate cancer, if you are 50 or above, you should go and get an annual health check, because the difference between early detection and late detection can mean saving your life.
We want you guys to be around with your families, to see your children and your grandchildren grow up. We don't want you dying prematurely because of ignorance. Once a year, commence an annual health and prostate checkup. If you don't do it for yourself, do it for your family, because they're the ones who want you around for a long time.